My name's Andrew Dodgson. I'm the clinical lead for microbiology and the infection control doctor at Central Manchester Foundation Trust. CPE are one of the organisms that we're currently facing problems with, and it's the latest in a long line of the evolution of antibiotic-resistant bacteria that we face in hospitals. The issue really is that they are resistant to so many of the antibacterials that we use, in particular the carbapenems, which up until now we've relied upon as our last choice antibiotic that we could rely on to treat almost any infection with a gram-negative. The question is, can you identify that case at the most as quickly as possible, and once you've identified that case, making sure that there is no further transmission afterwards. We're a hospital where we've controlled MRSA, we've controlled Clostridium difficile, but we've certainly found CPE far harder to control, and potentially thus one would imagine it's easier to spread. The implications for institutions across the world around CPE are the fact that these are such resistant organisms. We do live in a world with lots of travel, exposure to organisms that may not be as yet prevalent in the UK, and it's important that those patients who may have those risk factors are identified. I think if you're not identifying patients with CPE, then that may well mean that there are no patients in your institution or being admitted to your institution with CPE. However, the one thing you would want to assure yourself of is that you're conducting appropriate tests using an appropriate methodology, you're identifying the patients who are at risk and screening them, and you're following up enough cases. One of the problems with screening for CPE is the difficulties that we encounter with conventional culture. So it's not particularly sensitive, and culture can take a long time. We can wait up to 3 days to get a result back finally from culture. Being able to use a rapid, sensitive test where we get an answer within a matter of hours rather than days really impacts on what we can do with our patients. It means that we can isolate them, put appropriate measures in place a lot quicker, and from the patient's perspective it means that they're not shunted in and out of side rooms, moved around on a regular basis, so it can make a big difference to their quality of care.